Hello everyone, welcome to our channel Medical Online, and I'm Dr. Dawar, and in this video I'll be talking about the MRCS exam and specific structure which they're using for MRCS exam. Thanks so much for the response by you people on the last video, but in this video it's really going to be important for all those who want to be surgeons in UK, and specifically those who want to use the pathway of MRCS. So I will be just giving a brief description of the MRCS exam, and I'll be giving you some instruction as well for the exam preparation in the upcoming videos. Okay, before going to start video, please subscribe our YouTube channel Medical Online and also hit the bell icon so that you never miss our video on our channel. Right, starting from the exam, MRCS stands for Member of the Royal College of Surgeons. There are 4 colleges. I told you earlier people in the previous video there are 4 colleges. That one is of England, another one is of Edinburgh, and the third one is of Glasgow, and fourth one is of Ireland. You can choose any one of them. No difference at all in getting the training job or non-training job after doing MRCS, right? So MRCS exam actually are of 2 parts. Part A, number 2 is part B, right? Okay, so starting from the part A will be written exam, and there will be 180 MCQs overall, and 180 in basic sciences and 120 in general surgery part. So total it become 300 MCQs. You will have to solve them within 5 hours. There will be 5 hours exam. In between there will be 45 minutes of break. First of all, with basic sciences, you will have to read and prepare anatomy, because there will be 75 bulk of MCQs from anatomy, and 45 MCQs from physiology, and 45 MCQs from pathology, right? And in the remaining will be from pharma and the other general questions like that of pharmacology, and even they can ask about the microbiology. So the remaining question will be from there, but the bulk of MCQs is from anatomy. You will have to read and prepare the anatomy. Overall, you will have to focus on anatomy. 45 questions from physiology and 45 questions from clinical pathology. It will be part A exam. After 3 hours, they will take your part A exam, part A paper, and they will give you 45 minutes of break. In that break, you can take tea and all the things like that. They will give you time, and after just 45 minutes, you will again come to the hall with another paper, which will be of 2 hours and 120 MCQs, and that will be principle of general surgeries. Right, it will be totally about general surgery principle, in which they can ask you about the pre-operative and post-op care, and surgical techniques, management, and legal topics. Microbiology, even they can ask you here, and about microbiology, and emergency medicine and oncology. They can ask you about these things. And in specialty part, in the same, they will be asking you, or definitely asking you, about cardiothoracic, abdominal, upper GI, and hepatobiliary pancreatic part. There will be colorectal part. This will all be mixed, and they can ask you about specific question. There will be questions from breast, endocrine, vascular, transplant, ENT. Each and every part they usually touch it by giving you some question from that part. So you will have to prepare for that as well. In my opinion, the toughest for me was this one, because the scenario was too big and time was too short, and it was really hard for me to read the whole scenario in which the stem was too big, and then to answer the question. In this part, this was about for me was toughest. I was unable to read the question overall in that 1 minute time. Anyhow, but this is the main reason that the passing ratio of part A is only 30%. It's a big tough, but if you people will be following our advice and instruction, and I hope that you people will pass it. And all other is in your luck, and also your hard work definitely matters. Now coming towards the part B. Once you have cleared the part A, to be eligible for part B, you must have passed part A. The OSCE will normally consist of 18 examination stations each of 9 minutes duration, and one or more rest or preparation stations. Although the MRCS remain an exam for the core part of surgical training, 6 of the station will be examined in a specialty context, and the other 12 reflect generic surgical skills. You must specify your choice of specialty context station at the time of your application to sit the exam. The structure may change in the future, and also I must mention that before it was 18 station. Now after the COVID they have changed it, and now only they are taking 13 station, but it can be changed again, so you will have to follow their websites for any change in the structure of the MRCS Ascii. Like this one, before COVID it was all there were different stations and examination station in different countries. Like you will have to go to the hall, examination hall, and now they are taking it online. They have arranged specific software by which you will be able to take your exam and just uploading your MCQs answer. Then that's all. You will have just to be seated in your room in front of the camera and with nobody with yours else, and except you, there will be nobody over there. Everything changes with time. Like this is just because of the COVID, because they don't want to be like they don't want us to be in risk of getting the COVID. Right, coming again towards the part B, Ascii stations, there will be 4 type of stations. I'm talking about this station which was before COVID-19. Now they have arranged 13, and it's only 13 station over there now. But I'm talking about the 18th station because very soon they will be again able to take examination in the international station as well. These days they are taking exam only in Ireland and UK. Now no international exams are there. Okay, so specialty station, there will be number first anatomy and surgical pathology stations, right? And the second one will be about the critical care and surgical science, and third will be communication skills, especially in giving and receiving information and history taking from patient. Number 4th one will be clinical and surgical procedure station. There are 4 types of station in part B, so you will have to prepare for each of them. After taking your exam, each station is manned by 1 or 2 examiners and is marked out of 20 with a separate overall global rating. Like there could be pass, borderline, fail, and fail. 4 types of they can give you like the marks of your station. And there are 4 domains assessed throughout the exam, which are areas of knowledge, skills, and professional characteristics that a candidate should demonstrate. Like as this communication skills is really important, and this will be judged throughout the exam. There are 3 or 4 stations about communication skills only, but your communication skills will be judged throughout the exam, so you will have to focus on this, right? Like in our own country, we just focus that when we are taking your history, okay, what bring you today? And they told us, I'm having pain or fever. And they're not like that. You will be asking, okay, can I ask you something about your health? Yes, yes, doctor, I'm having pain. Oh, thank you so much. I'm really sorry about that, but nothing to worry. Like you will be able to give that proper communication skills that you will have to adopt, right? And they will judge your clinical skills and clinical knowledge, communication, and professionalism. The professionalism is really important for whole of the exam, Ascii exam, right? So the overall mark is calculated from both the mark out of 20 and the overall global rating. In order to pass the exam, you need to achieve the minimum pass mark and also minimum competence level in each of the 4 content areas and in each of the 4 domains. So you will have to pass each and every part. Like if you will be, for example, let's come, they're giving us marks out of 20, so just consider that they will be taking the passing mark of 12, that everyone will have to take 12 marks out of 20. So 12 out of here, if you will be not able to take 12 marks, you will be fail on this one and pass in this and top in this one, so you will be considered fail, because you will have to pass each and every station and separate, right? This will be your exam pattern, and what to study and how to study for MRCS. I will be giving you another video, and especially I will be giving my personal experience and personal which I have faced and the difficulties in each part. I will be telling you each and everything to prepare you people for the MRCS exam. After passing MRCS, you will be able to join the training and non-training job of in UK, right? But before that, you will also pass OET or IELTS. You will be able to get GMC registration after that. Hope this video will help you, and I will be giving you some important information about the questions over here which they can take and how they will be taking this question. So I will be giving you some example as well in the upcoming videos. Thanks for watching over this video, and kindly comment your opinion and also your questions you want to ask me, or you can also inbox us on our Facebook page Medical Online, and also our Instagram account Medical Online 1. Thank you so much for watching, and kindly subscribe our YouTube channel as well and support us. And in the upcoming videos, I will be talking about more about the instructions for MRCS Part A and Part B, and also about the syllabus which you should cover about for Part A and Part B. Thank you so much.